Hello, my name is Flaviana Amado. Currently, I am a master's student of the graduate program in Medicine and Biophotonics at the University 9 de Julho. Today, I will present my project entitled Randomized, Double-Blind, Parallel, Non-Inferiority Clinical Trial for comparison between therapy with Easotic versus photobiomodulation in canine otitis externa. My advisor is Professor José Antônio Silva Júnior. So, otitis externa is an acute or chronic inflammation of the external auditory canal. The etiology involves primary factors that are able to initiate otitis such allergens, secondary factors that are able to intensify otitis such bacterial and fungal infections, and predisposing factors that are able to increase the risk for otitis such neoplasms. And finally, perpetuating factors that are able to prolongate the overall duration of otitis such canal stenosis. So canine otitis are classified in three different types. Erythematous type, characterized by redness and excessive rooming, which is the focus of the study. Purulent types, characterized by a suppurative exudate. And proliferative type, characterized by signs of fibrosis, hyperplasia, and stenosis. The most common clinical signs include headache, pain, malodor, erythema, excessive ceruming, excoriation, and itching. The diagnosis is achieved through clinical history, physical examination, otoscopy, and complementary tests such as parasitological examination, cytology, and microbiological culture. The standard treatment consists firstly in remove the exudate and the excess ceruming with otological cleaning solution, and then apply topical products containing corticoids, antifungals, and antibiotics. So photobiomodulation is a non-invasive therapy that consists in delivering light at different wavelengths that pose different therapeutic effects. The purpose of photobiomodulation is to promote tissue repair, reduce inflammation, and promote analgesia using low-intensity light sources, such as lasers and LED devices. The rationale of this study is reduce the use of antibiotics as they cause bacterial resistance, avoid side effects of topical medication, and facilitate handling by owners since many complications can occur during treatment carried out at home. Demonstrates the effectiveness of photobiomodulation in veterinary dermatology, as suggested by Perigo et al., and standardize photobiomodulation parameters, still incipient in veterinary dermatology. So our objective is to verify if photobiomodulation can promote reduction in the ear erythema, reduction in the ear pain, reduction in the ear itching, reduction in the number of bacteria and malassezia SPP, and compare the clinical outcome of photobiomodulation and pharmacological treatment. The study will be carried out at the Dermacare Vet Center in São Paulo, Brazil, between August 2023 and December 2024. Inclusion criteria comprises small breed adult dogs older than 12 months age, males and females present bilateral or unilateral erythemeral, cereminals, and or hyperplastic otitis externa, and all dogs should have been treated with symperic within a 30-day interval. And the exclusion criteria comprise patients present complication during treatment that requires additional treatments, adverse drugs reaction during treatment with Easotic or physio, and patients who do not attend endpoints, patients undergoing complementary treatments carried out by owners or other veterinary. The evaluated parameters will be itching through the PVAS, pain, evaluate on a scale proposed by Bulback, otitis score proposed by Blake, and cytology through the otic swab. So 30 dogs will be enrolled in 3 different groups with 10 dogs in each. The first group will be the control group. The second group will be the drug group. And the third group will be the photobiomodulation group. So the study times comprise 18 days. In the first 5 days, we will use the cleaning solution in all groups. After cleaning, Easotic will be used for 5 days in the drug group. Just remembering that Easotic has a residual effect until day 18. In the photobiomodulation group, the dogs will be submitted to photobiomodulation every 48 hours. Cytology samples will be collected on days 1, 12, 14, 16, and 18. All animals will be submitted to clinical assessment on day 18. All patients in the control group will be treated at the end of the experiment if they present any clinical signs of otitis. To ensure irradiation of the entire ear canal, we will use a lead cluster device that's called BioX. Here in this box, we can see all the parameters such wavelengths, device features, radiant energy per point, and these parameters are in Portuguese because this is a print of a document formulated by Medicine and Biophotonics program. In the next 3 slides, all references will be cited. 2 and 3. Thank you very much for your time and attention.